A UTI, urinary tract infection, or sometimes referred to as a bladder infection, feels like when your bladder hates your guts. And then you go to pee and it's like pissing hot razor blades. But then you still have to pee again and again and again. And your bladder's just poking you and it hates you. Yeah, it feels like that. And for some reason, this tends to predominantly want to affect humans with vulvas or women. And so why is that? We're going to talk about it. Most humans with vulvas will experience the joy of a UTI at least once in their lifetime. And 1 in 4 women will experience or suffer from recurrent UTIs. That's 3 or more per year. But why? That's because our urethras, or the urethras and vulvas, are shorter than the ones in penises. And so it's easier for outside organisms to get inside into our bladder and wreak havoc. Sex is a very common trigger or risk for UTIs. And that's because vulvas are on the receiving end of penetration. And the act of penetration basically puts bacteria on the fast track to the front door of the urethra and inside your bladder. Again, it's like bacteria are on the highway or express lane to your front door. This does not mean that we consider UTIs to be the same as sexually transmitted diseases or sexually transmitted. It is not like the penetrator themselves has this bacteria in their body. They don't have a UTI. They're not giving you a disease they have. It's simply just the act of penetration itself that's bringing in outside bacteria to your body's front door. As if that's not already annoying enough, when humans with vulvas age and pass menopause, we're at even higher risk for UTIs. And that's because estrogen is protective against this bad bacteria that cause UTIs. And the decline in estrogen creates an environment that is more favorable for these organisms. Yeah, fun stuff.
Baby, I'm scared.
So what can I do about this? So when you start having symptoms of a UTI, even though you probably already have to constantly pee, it's important to drink more water. You want to try to flush things out. What you don't want to drink are bladder irritants like coffee, tea, soda, or alcohol. Drinking these is like pouring gasoline onto a fire. Please do not do this. Your bladder will hate you even more. And get a urine culture done. You can use over-the-counter medicines like Azo for urinary pain relief to help calm your symptoms while you wait. I mean, it can be night and day relief for some people. So, can you just permanently prevent a UTI from ever coming back in the first place? Answer is no. But you can reduce your risk of UTIs, thereby lowering the frequency. And I'll get to those details in my next video. So, like this video, make sure you subscribe, and join me next week, your favorite urologist, for more.